Getting healthcare out to rural areas in Kenya, such as Samburu County, can be a real challenge. Funds have been scarce and progress towards health goals slow. The good news is that change is afoot as the government of Kenya adopts new ways of getting more help for the money. Funds are now being sent directly from Nairobi to each rural health facility through a special fund known as the Health Sector Services Fund. It is paving the way for further reforms and improved results.
Under the old system, what would happen is any money we would send would get stuck at the district level. The idea of setting up the Health Sector Services Fund was to make sure that facilities got the funding and they would be responsible for it.
The Health Sector Services Fund is a Kenyan initiative financed by the government, the Danish International Development Agency, and the World Bank. Money from this fund is empowering rural health centers like this one in Kisima to improve and maintain their infrastructure.
Through the Health Sector Services Fund, we get the money directly to the facility accounts. It has changed so many things in the facility. For example, there are some facilities which didn't have stethoscopes, blood pressure machines, and renovations.
But that's not all. Using the systems and processes set up for the Health Sector Services Fund, rural health facilities in Samburu County are also trying a new way of financing health services called performance-based financing, or PBF. With a focus on getting more and better quality services to patients, PBF is being tested in Samburu with a grant from the Health Results Innovation Trust Fund, which is supported by the United Kingdom and Norway. PBF has been used effectively in other African countries like Rwanda and Burundi to improve delivery of health services and results.
So we are focusing on Millennium Development Goal related indicators, particularly on maternal and child health, like improved coverage for immunization, antenatal coverage, the institutional deliveries, contraception, as well as HIV/AIDS. And also there is a dimension of quality. If they are not meeting the quality standard, they will not get any money.
In Kisima, motivated community health workers are encouraging more women to bring their babies for growth monitoring and full immunization. 9-month-old Nsekwa has been brought in for her measles vaccination. She is now fully immunized. Her mother, Rispa, heard about the service from a community health worker.
Before the introduction of the PPF, immunization in average, we are about to receive clients 18 per month, but now is around 39.
Early results show that the number of children fully immunized before their first birthday throughout Samburu County has gone up by 28%. Given the shift in focus towards performance, health workers are also getting more pregnant women to come in for regular antenatal checkups and to deliver at a health center. The number of women getting at least 4 antenatal checkups has gone up by 20% across Samburu County. Mercy, who is in her 36th week, is now making her 4th visit to the Kisima Health Center. Also registered at Kisima Health Center is Suri. She has recently delivered her 3rd child with skilled assistance at the facility. Other non-governmental health providers in the area, such as the Catholic dispensary in the nearby town of Madalal, are also receiving some PBF incentives from the government.
You know, working too, it's not just small thing, it's a hard work, but getting that money, it motivates us so much to work extra hard.
With PPF, what we are asking them is perform and we'll pay you. So it is basically asking them to account in terms of results framework. What did you do with the money? Did you produce the results?
Verifying results is an important aspect of performance-based financing, and implementing partners already working in the area, like World Vision and the African Medical and Research Foundation, or AMREF, are playing a key role.
There is a joint verification team that actually, at the end of every quarter, goes to verify what has been reported in the District Health Information System. So once we have verified that as partners and in conjunction with the Ministry of Health, then the ministry can actually give out the incentives. If they have confirmed that the services that are being provided are both quality services and that the community members are actually benefiting.
Although remote, Kisima and Maralal are not the end of the road. In fact, it is further into northern Samburu County that the going really gets tough for healthcare. Here in Suyan Manyata, a grueling 4-hour drive from Maralal, people appreciate health workers making routine visits to immunize their children, but have to go a long distance to get help when they urgently need it. This is a part of Kenya left untouched by the mobile revolution. There are no telephone services, not even in the large village of Barcelona, where a public dispensary and one run by Colombian nuns stand side by side. Agnes walked an hour in the midday sun to bring her grandchild, Salini, to be immunized. It turns out that Salini does not need immunization today, but instead, she has an ear infection which Stephen, the health worker in Barcelona, is able to treat. Too often, though, distance can prove fatal. When Salini was just a week old, her mother died of complications from childbirth.
Even if we are helped very much by the PBF to scale up the indicators, maybe on deliveries, on immunization and other things, we are having very much problems with the transport. There is nothing that we can use to communicate in this place, a distance of 50 kilometers where we have the referral system.
Next door at the Catholic dispensary, Sister Elisa echoes Stephen's views.
We're planning with the statement that he is going to see to visit some outstation and we another. Sometimes really we need a doctor, but the special case we have to refer to Marala.
While performance-based financing cannot fix all the problems in remote areas, it is helping to improve the quality of services delivered. The district public health nurse who is visiting assesses the dispensary's vaccine storage as part of the audit of the facility.
To check on the quality of the immunization you provide, we look one on how you store your vaccines. So we have to look at the fridge, how you arrange your vaccines in the fridge, because the vaccines are arranged according to the sensitivity to heat.
The World Bank's lead health specialist in Nairobi is upbeat about Kenya's efforts to increase accountability, clean up data on services provided, incentivize workers, and improve results.
The very important lesson here is if such success can happen in a very challenging environment like Samburu, where the distances and access remains a real challenge, this model can be very well replicated in other counties.
Kenya is now keen to expand PBF to more counties. This approach will help to further expand service delivery in remote areas. especially through faith-based organizations. These changes are intended to be a shot in the arm for Kenya's healthcare as the country strives to meet the Millennium Development Goals and to confront the serious challenge of maternal survival. 40 women still die every day in Kenya due to pregnancy-related causes.
In terms of reducing under 5 mortality, we should be able to reduce it by 2015. Where we have not progressed that much progress is on reducing maternal mortality. That is where we'll be sort of concentrating on the next 3 years.